just an average day. Or so it seems. But today is anything but average.
Wait, why don't you open your card?
Okay.
And then it hits. It's time for Mike's colon cancer screening.
Whoa.
While getting screened for colon cancer can lend itself to humor and stories told by anyone who's been through the process, the truth is, it's no laughing matter. And the best defense against getting colon cancer is screening. The bottom line is, colon cancer screening must begin at age 50. Let's look at the facts. Colon cancer is the third most common cancer and the second leading cause of cancer-related deaths in the United States. African Americans are at a higher risk and should begin screening at age 45. And studies show that poor eating habits and a personal or family history of colon cancer, uterine cancer, ovarian cancer, and colon polyps may raise your risk of colon cancer.
My brother was 17 when he was diagnosed with colon cancer. He had part of his colon removed. He went through chemotherapy. He was actually cured. He was fine, and I want to say he was fine for about 6 months. And then he started with stomach pains again. They found that the colon cancer had come back. He passed away at the age of 19. He was sent into hospice. Because of my brother being diagnosed at such a young age with colon cancer, I've already scheduled my colonoscopy.
The colon is the large intestine or large bowel, and the rectum is the area between the colon and the anus. Colorectal cancer occurs in the colon or rectum and begins when a colon polyp becomes cancerous. A colon polyp is a small clump of cells that forms on the inside of the colon. Most polyps are harmless, but some can become cancerous over time. Symptoms of colorectal cancer can appear in a variety of ways. Signs to look for include blood in your stool, frequent stomach aches, pains or cramps for no reason, a change in bowel habits like having stools that are more narrow than usual, and losing weight. However, these symptoms often appear in the later stages of colon cancer, and those who develop colon polyps are unlikely to ever know that they have them without a screening. So how can you tell if you have colon polyps? You can't, which is why doctors tell people to start screening at age 50, and for African Americans to begin screening at age 45. If you have a family history, you should also talk to your doctor about getting screened 10 years earlier than your relative was diagnosed. Polyps found early can be removed before they become cancerous, and when colorectal cancer is found early, more treatment options are available. Simply put, screening saves lives.
I think people avoid a colorectal cancer screening for fear that something bad will be found, that a cancer will actually be found. But in fact, colorectal cancer can be prevented with a colorectal cancer screening. I think a lot of patients aren't aware that they're usually asleep and made very comfortable for the procedure. I think they think that they're going to be awake, and I mean, there have been things shown on TV where the patient is actually awake during their colonoscopy, and that's not the case. We make sure the patient is very comfortable for the procedure. Colorectal screening allows us to diagnose cancer earlier, or even prevent cancer. We want to diagnose it before a patient has signs or symptoms of cancer. Then it's at an earlier stage, and that's what colonoscopy allows us to do.
I did increase the conversation, you know, you're gonna have to have that done. And he was like, nah, I really don't have to have it done.
She increased it, but I wasn't hearing that. Yeah. I actually blocked it out.
Oftentimes in many communities, in many races, especially African Americans, I mean, it's a taboo thing, it's something you don't discuss. Most males don't want to have it, and especially most black males, African American males, different nationalities, ethnicities, they think that that's something wrong. You don't have to do screening.
It was a breeze. I actually got worked up for I'll say it. Okay. I actually got worked up for nothing.
The bottom line is, if you're 50 or older, talk to your doctor about getting screened.
As an African American, please get tested early.
Get screened today.
Do something good for yourself. Get screened today.
Please do what I did. Please get tested.
If you're Hispanic, get tested today.
Celebrate your 50th by getting screened.
African Americans are at higher risk for colon cancer, so please begin getting your screenings by age 45.
Don't wait until you have symptoms.
Call your doctor today.